a native of Holland, Canada. She currently resides in Utica and has been happily married to her husband Rich for 10 years. She is a proud mother of 9-year-old Max, 8-year-old Noah, 5-year-old James, and 2-year-old Isabella. Kate homeschools her children and enjoys photography in her free time. Kate was diagnosed with breast cancer in May of this year and is currently undergoing treatment. She has kindly agreed to share her story and her survivorship with us today.
Good afternoon. I'm happy to be here to talk to you all today. My name is Kate. I am 34 years old. I have 4 beautiful kids, as you heard, and we homeschool. And I'm currently undergoing chemotherapy for breast cancer. I think before my diagnosis, I had some preconceived notions just about how you go about finding breast cancer. To me, I thought that you would find a lump, you'd go in, you'd see a doctor, you'd get a mammogram, they do a biopsy, and then you'd find out that you have breast cancer. And for me, my particular diagnosis kind of took a different path. It all started for me back in March of this year. It was a normal day, and all of a sudden I started having pain and swelling in my right breast, and I thought this was weird. I had stopped breastfeeding my daughter almost a year before. I thought this was strange, so I immediately called Nancy Peak, who is my midwife / nurse practitioner, and she works over at Mohawk Valley Women's Health Associates in Rome. And I have a very good history with her. I was there for her for all my pregnancies and all my kids' births, so I trust her implicitly with my health care. So I went and saw her, and she checked me out, and she said, "Oh, don't worry, it looks like it's just mastitis." I thought, okay, easy fix. She gave me some antibiotics, and I took the antibiotics. It cleared right up, and I carried on with my busy life. So I was surprised when a few weeks later, I was in the shower doing my normal self-breast exam. I was always good about doing those. I noticed that I had worrisome discharge. So, of course, I immediately picked up the phone and I called Nancy, and she set up my mammogram and ultrasound for the very next day. So I went in, and it was my very first mammogram, and not to spoil the ending, but it was also my very last mammogram. And I had the ultrasound, and I was very relieved when they told me that they both looked perfectly clear. I was like, oh, phew. But I was concerned because we still did not have a cause for the discharge. So I went in to see Nancy later that week, and she said, you know, everything looks clear. The radiologist is recommending you come back in 6 months, but personally, I like you too much to wait that long. And really, I am just so grateful to her, because without that, my cancer very well would still be undiagnosed to this day. So what she did was she referred me to a breast surgeon, and I asked around a lot of people getting recommendations, and by and large, it was unanimous. Dr. Simon was the man to see. So I made an appointment with him and went in and saw him a couple weeks later, and he did an ultrasound in his office. And they did find something on the ultrasound. They saw something in one of the milk ducts. We weren't quite sure what it was. He believed it was most likely what's called an intraductal papilloma, which is benign. It's a small benign tumor that grows in your milk ducts. When you get them all the time, and while it's benign, it can't hurt you. They occasionally can accompany cancer. So the recommendation is that they take them out and do the pathology just to make sure. So we set up an appointment for that surgery, and I had that done the end of May. And I remember very distinctly him coming into the room after my surgery and saying, most likely this is nothing at all, 95% chance it's going to be, nothing. But so I remember thinking that I only needed to be 5% worried. So I wasn't terribly concerned at that point. And then on the evening of June 2nd, I got a phone call from Dr. Simon, and he called to let me know that they had found what's called DCIS, or ductal carcinoma in situ. And what this is a pre-invasive breast cancer. So I was shocked and surprised and upset, obviously. I was very relieved that at least we had caught it at the pre-invasive invasive stage, so I cried, I regrouped, I called my mom. For the record, I really liked the phone call method. I know some might think that's a little, I don't know, not as sensitive as you might prefer, but for me it was really good to be able to deal with it in the comfort of my own home. And then I'm a researcher by nature, so I immediately got on the computer and did a lot of reading. I made my whole list of questions to bring into the doctor's office the next day. So that worked out well for me. I went in to see Dr. Simon the next morning, and he spent so much time with us. He answered every question that I could have possibly had. He sat down, he went through every step of treatment, which at that point was going to be lumpectomy and radiation, followed by 5 years of tamoxifen. Also, while I was there that day, I went and had blood work done for the BRCA gene mutation test, and that test just to see if you might have something genetic in your background that is causing the breast cancer. I do not have a large family history. I have one family member who was diagnosed, my great Aunt Pat, who was diagnosed at the age of 76. She had a mastectomy and 5 years of tamoxifen, and at age 85, she's still going strong, I'm happy to say. So I had that test done, and then later on that week, he also sent me out for an MRI, just to see if there was anything that maybe we missed, considering nothing had shown up in the test previous to finding the cancer. So I went in and had that MRI done, and then I got another phone call from Dr. Simon saying that he had some good news and he had some bad news. The good news was that my gene mutation test had come back negative. For that I was very relieved. The bad news was that they did find a very worrisome spot, as the radiologist called it, a 7-centimeter spot in my breast, of little spots that could concern the radiologist. So they wanted me to go in and have an MRI-guided biopsy. So I went in and had that done, and then a few days later, I got another phone call from Dr. Simon, this time telling me that they did find invasive cancer. It was, at that time, they had found 8 millimeters of grade 1 invasive ductal carcinoma. And because it was in a different area than the DCIS, I was going to need a mastectomy. I knew that if my gene mutation test had come back positive, that it was most likely going to be recommended that I have a bilateral mastectomy. So I kind of been mentally preparing myself for that loss. So it was, while it was disappointing, obviously, nobody wants to have some part of their body amputated, I knew that it was kind of on the table, as it were. So, and because I had not had any of my cancer detected by the normal routine tests, like a mammogram or an ultrasound, I had no palpable lump. I opted to go with a bilateral mastectomy anyway, even though they had seen nothing in my other breast. Just for my own peace of mind, I didn't want to live with that kind of worry afterwards. So, after that, I had my appointment at the Breast Care Center with Karen Miller. It was wonderful. She spent a very long time with us going through kind of what to expect after the surgery, just kind of sitting there listening to my story and comforting me about kind of what I was going to be dealing with. And it was really helpful to kind of be prepared for what to expect after such a big surgery. So on July 20th, I went in for my bilateral mastectomy. This sounds weird, but I was actually really eager to get it done. I did not look at it as a loss of my breast, but getting the cancer out of my body, and I was really eager to do that. And it went really well. The nurses were awesome. They actually put me on the pediatric ward. I said, I know I look young. I didn't know I looked that young. So, but the nurses were awesome, really, really great. And a friend of mine from our congregation who was going through colon cancer treatment at the time, she said, you will never feel more loved. And she was so right. I was humbled by the amount of support from my family and our congregation. It was really amazing. Never had more flowers in my life. So after my surgery, they had removed 6 lymph nodes, and they looked clear at the time, but upon further examination, they did find what's called micrometastases, which is just a very small amount of cancer cells in one of my lymph nodes. I had 0.5 millimeter of micrometastases in one node. So my final staging and everything, they had found 1.3 centimeters of grade 1 estrogen and progesterone positive, HER2 negative invasive ductal carcinoma, which puts me at stage 1B. So I'm so grateful that we caught this as early as we did. I think that, you know, if we kind of let it go on and hadn't pursued this, I hate to think of what could have happened. I also had a genetic test done on my tumor, which is called an Oncotype DX, where they look at your tumor and they give you a recurrence score to kind of, they give you a number between 0 and 100 to see what the likelihood of your breast cancer returning in the next 10-year period is. And I scored low with a score of 13, but because of my young age and because there were those cancer cells in my lymph node, the oncologist and I both agreed that chemo was the way to go. So I'm currently going through 4 rounds of chemo, taxotere and Cytoxin. And while it's been hard, I'm not going to lie, it's been very doable and much easier than I thought it was going to be. There were lots of side effects that I read about and scared myself about, but I did not get, so I'm happy for that. And I'm very happy to say that my last chemo treatment is next Friday, the 29th. 5 years of tamoxifen, and I'm really eager for my hair to grow back. I have to be honest, I was really surprised when Karen called and asked me to speak here with you all today. I was only diagnosed 4.5 months ago. I'm still in treatment, and I wondered, am I even considered a breast cancer survivor at this point? So I gave it a lot of thought, and I actually turned to the dictionary and I looked up the word survive, and it says to carry on despite hardships or trauma. And I feel like that's what I have been doing. I think that you can consider yourself a survivor when you hear the words that you have cancer, and you look up from those first feelings of despair, and you decide that you will fight this, and you're going to beat it. So, well, a diagnosis of breast cancer has surely impacted my life. I'd like to really focus on the positive that it's brought to me. It's had a lot of positive changes on me. It's strengthened my faith and my relationship with God. I've been able to experience such a loving outpouring of love and support from all my friends and family. And I've learned that I do have the strength to get through something like this with my positive attitude and my sense of humor still intact. And I obviously have a much deeper appreciation for all the blessings that I have in my life. I appreciation that getting older is a privilege. I really look forward to hitting 40 now, where I might not have earlier. I really look forward to seeing my kids grow up. Whereas before I might have gotten a little wistful about, them getting older and bigger. I really am just so grateful that I'm able to be here and see it. And I really try to step back and enjoy all the blessings in my life rather than getting caught up in just day-to-day stuff. And while I think anyone who has had a cancer diagnosis in their life will always wonder if the disease is somewhere there lurking in the shadows, I refuse to live my life in fear of recurrence. It's completely out of my control, and all the worry in the world is not going to affect the outcome. And just the simple fact that it could come back is all the more reason that I'm going to enjoy every day to the fullest. Okay. To wrap this up, I want to share with you that I have a phrase that has been keeping me sane through all this. There's a lot of decisions you have to make and a lot of rough stuff you got to deal with. So my phrase is, it is what it is. You're going to deal with it, you're going to move on, and you're going to get through it. But I really look forward to reaching the point where I can look back and say it was what it was. Thank you.